Mrs. Rafia, 28 years old, housewife, got education till FA, resident of Gushnik Bal, which is 15 minutes away from the Index Hospital. She is married for the last 8 years to Mr. Muhammad Ali in a consanguineous marriage. She is gravid at 3, prior to abortion 0, having all lower segment cesarean section and all her life issues. Her last childbirth was 3 years back. The first day of her last menstrual period was on 20th of March 2020, making her estimated date of delivery is 27th of December 2020, and today she is at 32 plus 5 weeks of gestation. Patient is admitted to labor room on 3rd of November 2020 with the complaint of vaginal bleeding for the last 3 hours. My patient conceived spontaneously. Pregnancy was planned and she got it confirmed by urine pregnancy test at home. No history of excessive nausea, vomiting, high grade fever, flu, rash, vaginal discharge, or bleeding. No history of folic acid intake in first trimester. Her pregnancy remained uneventful and unsupervised till fourth month of gestation when she went to a local doctor and get her ultrasound done, in which she was told that she is having single alive intrauterine pregnancy of fourth month gestation. She perceived normal fetal movement first time in fifth month of gestation. No history of anomaly scan or iron or calcium intake in second trimester. My patient booked herself in the Index Hospital at seventh month of gestation when her blood and urine tests were performed, and according to her they were normal at that time. Her ultrasound was done and she was told that she is having single alive intrauterine pregnancy along with placenta previa. She was advised to take bed rest and regularly take her hematinics. No history of lower abdominal pain, vaginal leaking, vaginal bleeding, increased blood pressure, easy fatigability, weakness or shortness of breath. She is perceiving normal fetal movement and growth of her abdomen is according to gestation. Now, from the last 3 hours, she developed a complaint of vaginal bleeding. It was sudden in onset, not preceded by any coitus, trauma, or abdominal pain. She soaked three homemade fully soaked pads since then, and with the passage of pea-sized clots. Her fetal movement remained normal before and after the bleeding episode. Now, for this complaint, she got here in labor room and got admitted. Now, after admission in the hospital, her urine and blood tests were repeated, in which she was told that her hemoglobin was low and she was transfused with 1 pint of blood with no post transfusion reaction. She also received steroid cover for fetal lung maturity. Her CTG is being done 2 times a day. Ultrasound is done, which confirms placenta previa. Her bleeding, my patient's bleeding stopped itself 1 day back, 1 day after admission in the hospital. She had previous two C-sections, so she wants to deliver by lower section cesarean section. However, time of delivery is not discussed with the patient. My patient is gravid at 3 prior to abortion 0. Her firstborn was 5 years back. It was spontaneous conception, supervised pregnancy. She has no antepartum, interpartum, and postpartum complication. Delivered through lower section cesarean section at term due to failed induction at some private hospital. Her baby was average weight and delivered with good APGAR score. Her second born was 3 years back. It was also spontaneous and supervised pregnancy. He has no antepartum, interpartum, and postpartum complication. She delivered through section, cesarean section at private hospital due to having one previous cesarean. That baby was also delivered with average weight and good APGAR score. She breastfed her both babies and vaccinated them too. Her age of menarche was 30 years back. Since then, her cycle was regular, occurring every 30 days for 6 days, and she soaked 2 to 3 pads per day. No history of pap smear, or she didn't practice any kind of contraception before. She has no significant past medical history, but has two previous cesarean sections. No family history of diabetes, hypertension, ischemic heart disease, hepatitis C, TB, or asthma. She is non-addicted, non-smoker, has no drug allergies, and has regular sleep and bowel habits. My patient lives in a rented house. Her husband is a shopkeeper and he earns 1,000 rupees per day, and they met basic necessities of life with difficulty. On examination, a 28 years old lady sitting comfortably on couch, well oriented in time, place, and person with BMI of 25 kilogram per meter square. Her pulse rate was 84 per minute, beats per minute. Blood pressure was 110 by 70 millimeter of mercury. Respiratory rate was 16 per minute, and her temperature was 98 degree Fahrenheit. She was pale looking. Pallor was positive in conjunctiva. However, she don't have any jaundice, clubbing, chylonychia, cyanosis. Her oral dental hygiene was satisfactory. Thyroid was not palpable and accessible lymph nodes were not enlarged, and she was having no pedal cycloedema. Her breasts were bilaterally symmetrical with no obvious swelling or discharge. Apex beat was in fifth intercostal space in mid-clavicular line. She was having normal first and second heart sound with no added sounds. She was having normal vesicular breathing and bilateral equal air entry on both sides. On the abdominal examination, her abdomen was protuberant with central inverted umbilicus moving symmetrically with respiration. She was having stria gravidarum, infinite T in CN star mark. Her hernial orifices were intact. The height of her fundus was 32 centimeter with lie longitudinal and presentation breech. Liker seems to be adequate, and her estimated fetal weight was 1.5 to 2 kg, and fetal heart sounds were 140 beat per minute. Ma'am, I want to know about investigations of the patient.
What you need?
Blood group with Rh factor.
Blood group A negative,
Ma'am, I want to know husband blood group
husband blood group OA positive,
and indirect Coombs test.
negative,
Okay, ma'am, I want to know about full blood count in which I need a hemoglobin uh, and total leukocyte count and platelets. I need this report with date.
hemoglobin 8 gram per deciliter, TLC platelets normal,
Ma'am, pre-transfusion or post-transfusion this report
pre-transfusion,
and post-transfusion HB.
not available,
Okay. I want to know about RBC indices, mean corpuscular volume, mean corpuscular hemoglobin and hemoglobin concentration.
all indices are normal,
Okay. Ma'am, I want to know about peripheral smear.
not available,
Ma'am, I
normocytic
want to
normochromic anemia on peripheral smear.
Okay. Ma'am, I want to know about time random blood sugar.
What do you mean by time random blood sugar?
Ma'am, on which is done on any time randomly in a day when she got admitted.
130.
Okay, ma'am, I want to know about urine complete examination for microscopy and biochemistry.
On microscopy 1 to 2%, glucose nil, protein 2 plus.
Okay. प्रोटीन मैम प्रोटीन प्लस टू बताया ना आपने
Yes,
प्रोटीन मैम आई वांट टू नो अबाउट हेपेटाइटिस बी सरफेस एंटीजन एंड एंटी एचसीवी एंटीबॉडी
negative,
ओके मैम आई वांट टू नो अबाउट 24 आवर यूरिन प्रोटीन एज शी इज हैविंग प्लस टू
not available,
यूरिन I want to know about liver function test for bilirubin, AST, ALT, and ALP.
not available.
What about RFTs for serum urea and creatinine? Hello?
RFT is not available.
Okay. Ma'am, I want to know about dating scan.
What you need on dating scan?
I want to know about whether it is single or twin gestation and fetal cardiac activity and gestation of on scan we did.
Single fetus FCA positive and corresponding to gestation.
Yeah, ma'am, I want to know about recent scan for fetal biometry, amount of Liker and placental localization, and also her fourth month scan, seventh month, sorry ma'am, seventh month scan, her seventh month scan.
On anomaly scan, low-lying placenta and recent scan we'll discuss later.
Okay, no, like, okay.
Anything else you need?
No, ma'am.
Okay, summarize.
Ma'am, 28 years old, capital C, para 2, abortion 0, presented, admitted for the management of low-lying vaginal bleeding, which is due admitted for the management of vaginal bleeding due to low-lying placenta and management of moderate anemia. She is having on PA. She is having 32 centimeter fundal height, lie longitudinal cephalic, like her adequate and estimated fetal weight was 1.5 to 2 kg, and fetal heart sounds was 140 beat per minute. She is having 8 grams per deciliter HB hemoglobin. Her blood group is A negative, and she is having 2 plus protein urea during examination. And on scan, on a normally scan, she was having low lying placenta.
What is age of your patient?
I'm 28 years,
And her gestation?
32 plus 5 weeks.
What is her previous mode of delivery?
Yes, ma'am. She previous to cesarean section. दोबारा बताओ. दीक्षा दोबारा बताओ.
नहीं, अब मैं खुद ही बता देती
28.
हूँ.
हाँ जी.
Gravida 4, para 3, previous to C-section at 32 weeks, 3 days with low-lying placenta, iron deficiency anemia. Symphysis fundal of 32 centimeter, longitudinal live breech presentation, estimated fetal weight 1 to 1.5 kg and fetal heart rate 142 beats per minute. With a negative blood group. कोई चीज़ मिस हुई है
ठीक
आपके
है.
मरीज की?
नहीं.
तो यार खूबसूरत सी समरी सुनाया करो, कैसे इधर उधर की गंदी बातें बताते रहते हो.
ठीक है. Previous to cesarean section admitted for the management of low lying placenta and iron deficiency anemia.
अब ये
And
एडमिटेड फॉर मैनेजमेंट और इन सारी चीज़ों की कोई सिग्निफिकेंस है? देखो एज 28 ईयर्स इस पेशेंट में इसलिए इम्पोर्टेंट है एज शी इज हैविंग लो लाइंग प्लेसेंटा एंड शी माइट नीड हिस्टेक्टमी. 28
hysterectomy.
ईयर्स, ये आप लिखें समरी.
जी. लिख रही
28
हूँ.
years, Gravida 4, para 3, previous to C-section at 32 weeks, 3 days,
Previous to. ठीक है.
with low-lying placenta, iron deficiency anemia, negative blood group, symphysis fundal height of 32 centimeter, longitudinal live breast presentation, estimated fetal weight 1 to 1.5 kg, fetal heart rate 146 beats per minute. कोई चीज़ मिस हुई है आपके मरीज की?
ठीक है. नहीं.
और आप लोग इतनी लंबी समरी बताते हो, सारी चीज़ें बता दी है ना,
हाँ जी.
और ये 2 लाइनों में खत्म हो जाती है.
ठीक है. Negative.
ये पूरी हिस्ट्री दोबारा नहीं सुनानी.
ठीक है. ठीक है.
ओके, व्हाट इज योर प्रोविजनल डायग्नोसिस?
Ma'am, Category 3, Para 2, abortion 0, age 32 plus 5 weeks of
ये
gestation with
वर्ड
low lying place.
एबॉर्शन ऑब्सलीट हो गया. दिस इज मिसकैरेज विद नो मिसकैरेज.
Okay. Category 3, Para 2, with no miscarriage at 32 plus 5 weeks of gestation with low lying placenta and iron deficiency anemia.
ओके, हाउ डू यू डिफरेंशिएट इफ ब्लीडिंग इज ड्यू टू प्लेसेंटल एब्रप्शन और प्लेसेंटा प्रीविया?
Ma'am, on history, I didn't found any risk factor for placental abruption like increased BP or history of smoking, or she don't give me any history of pain abdomen at the time of bleeding. It was painless bleeding, and fetal heart sounds was she was perceiving normal fetal movement before and after the episodes, and fetal heart sounds was normal after admission in the hospital.
ओके, is there any difference between bleeding, amount of bleeding or color of bleeding in abruption and previa?
Yes, ma'am. Bleeding color of bleeding in case of placenta previa is fresh red color, while in case of placental abruption, it is stale or dark brown in color blood.
What are grades
And
of placental abruption?
ma'am, there are three. There are grades of three grades of placental abruptions. First, the grade zero. In grade zero, patient is asymptomatic, and there may be small little placental clot which is discovered after the delivery. In second, grade two, vaginal bleeding, which leads to uterine tetany. Tetany is caused by infection in the uterus. tenderness, but no signs of maternal shock or fetal distress. In second, in grade two, external vaginal bleeding with no sign of maternal shock, but fetal signs of fetal distress. In fetal heart rate abnormality may be found, and in grade three with fetal demise and maternal shock. Vaginal bleeding with fetal demise and maternal shock.
What is incidence of maternal mortality in placenta previa?
Placenta previa.
Hmm.
Um, Ma'am, 10 to 20%. I am not sure about this.
You need to confirm this. How we classify low-lying placenta or
Okay.
placenta previa?
Ma'am, this minor degree and major degree previa. In minor degree, when placental bleeding edge of placenta is way more than 20 millimeter away from the or 2 centimeter away from the internal os, and when it is within the internal os, no, it is when it is within the internal 2 centimeter of the internal os but not covering the os, then it is minor degree previa. And third degree major degree previa, it is partially or completely covering the internal os.
Why you asked for liver function test and renal function test?
मैम बिकॉज एनेस्थीसिया हमारे मैम हमारे सेटअप में मोस्टली प्रीविया को ना जिए देते हैं तो इस वजह से ये इन्वेस्टिगेशन हम करवाते हैं
Then why
इसमें.
you need liver function test or renal function test for general anesthesia in 28 years patient?
मैम प्री रिक्विजिट्स है मतलब लैब ये तो
What is reference for
वो
this?
करवाते हैं. मैम रेफरेंस तो नहीं है, बस एक चीज जो वो प्री रिक्विजिट्स में चल रही होती है यूनिट के, वो ही
Then
है इसमें
while
तो.
you are preparing for international exam and you have no reference for this. In exam or in patient management, there is not a single word or single investigation or single counseling or single management without any recommendation, evidence or written evidence. What is type of
मैम
anemia in your patient?
Ma'am, you gave me, she patient gave me history of normal labs which was done at 7th month of gestation. Then now she is transfused with 1 pint of blood, and here her hemoglobin 8 grams liter which you gave me, and her RBC indices are normal and also normocytic. She is having normocytic normocremi anemia on peripheral smear. Maybe she is having sudden drop of HB due to bleeding, as she gave me history of 3 to 4 pads per day she soak in 3 hours. सडन ड्रॉप उसका उसकी वजह से ब्लीडिंग की वजह से हुआ है.
How you excluded iron deficiency anemia?
मैम पैराटिन नहीं करवाया, मैंने सोचा था, पर मैंने ये बल्कि पूछना था आपसे कि अगर इंडिसेस भी नॉर्मल है और वो भी, तो इतनी जल्दी ट्रांसफ्यूजन के बाद तो नहीं इंडिसेस नॉर्मल हो जाएंगी, या मिक्स पिक्चर आएगी, तो फिर इस पे से मैंने पैराटिन नहीं मांगा. मैं आपसे पूछूंगी कि
Even then,
कैसे
can
भी
she
करूंगी
have
तो
depleted iron
पैराटिन
stores
खा
or
लूँ.
not?
यस शी कैन हैव.
What is depleted iron stores?
मैम when ferritin is less than 15 nanograms per
What are
liter
stages of anemia
serum
development?
ferritin.
Which parameter is
मैम फर्स्ट stage is deficient iron store. Three stages. First stage is deficient iron stores. Second is deficient iron store are leading to deficient erythropoiesis, and third is decrease in hemoglobin and decrease in presentation of anemia.
so was it
Third stage.
important in this patient even if she was having normocytic picture to know that is she
Yes, ma'am. It
having
is
depleted
important.
iron store?
Yes,
Okay, how will you manage your patient?
ma'am. First of all, I will complete my missing investigation. For that, I want you to give me her recent ultrasound for fetal biometry, amount of Likert, and placenta localization.
Placenta completely covering the os. Biometry, Likert, and all other parameters are normal.
Ma'am, I want you to give me Doppler, color flow Doppler for ruling out morbidly adrenal placenta, as she is having previous two scars
No evidence of
and now
morbid
major.
placenta.
मैम इसका फिर फेरेटिन फिर बता दें, फिर उस मैनेजमेंट में उस तब मतलब उस तरफ फिर अगर आयरन इसको आईवी आयरन देनी है या वो
Now you
बता
have
दें
no
मैम फिर
time for
फेरेटिन.
investigations. You need to manage your patient.
After confirming my diagnosis, I will approach the patient and counsel her that she is having high risk pregnancy, and as she already knows that she is having low lying placenta which is completely covering the os, I will counsel her regarding its fetal-maternal implications,
सिर्फ
and
मरीज को
I will
बताना
counsel
है,
her about
उसके
the
किसी
need.
घर वाले को भी बताना है वो?
Attendant को भी मैम, अटेंडेंट को भी, हस्बैंड
What do you mean by
पेशेंट को
attendant?
मैम, हर हस्बैंड, most importantly her husband and the family
Okay.
members which you want to know about her condition. I will counsel her that the need of, I will counsel them regarding the need of extended hospital stay, regarding the need for additional investigations if needed, and bed rest, and need to arrange blood. My management will depend upon maternal and fetal condition, her gestation age, and onset of labor. And she is having previous two C-sections, so my if everything remains fine, so my mode of delivery will be through LSC, lower section cesarean section at 38 weeks. As her bleeding stopped now, and she is at
Why
32
38
plus
weeks?
5.
Why 38 weeks?
मैम अगर सब ठीक रहता है, वो ब्लीडिंग दोबारा नहीं होती और फीटल और मैटरनल कंडीशन ठीक रहती है, तो आई विल
What
टेक
is
हर टू टर्म.
recommended gestation for delivery in case of major degree placenta previa?
37, 36 to
Then,
37.
then why you are prolonging her by 1 week?
37 weeks. I will be delivered her through a lower section, cesarean section 37 weeks. As her bleeding stopped now and she is at 32 plus 5 weeks and steroid cover is always giving to her. I will continue with expected management in which I will keep her admitted. I will check her vitals two times a day and do her CTG daily. I will continue her with the hematinics.
For how long you
Ma'am,
will
it
keep her
will,
admitted? And why you are
ma'am, I
telling?
will, yes ma'am, why?
You are telling her about need of prolonged hospital stay, as she is bleeding freely for the last 2 days.
Ma'am, I will discuss with the patient as her house is 15 minutes away from the hospital. I will discuss each and everything with the patient and her husband and with regarding the pros and cons of admission and discharge. She will have to fulfill the criteria if I discharge her, but all
Have you
this
not
I will
taken
discuss
history
with
of your patient? Why you are not for her to
नहीं
decide to keep?
मैम मैंने ये नहीं पूछा था उससे कि अगर उसको डिस्चार्ज
Where
करते
your
तो वो
patient
आज
came?
बहुत सारी चीजें.
From where she came?
Ma'am, she came from a town which is 15 minutes away from the hospital.
What is profession of her husband?
What is? मैम क्या पूछा आपने?
उसका हस्बैंड क्या करता है? उससे पूछा था घर में
मैम
कोई
उसका
कन्वेंस
हस्बैंड,
है?
हाँ जी.
उसके 2 बच्चे हैं, उनका कौन ख्याल रख रहा है? वो घर जा सकती है, वापस आ सकती है इन केस ऑफ एनी इमरजेंसी, या नहीं आ
ये
सकती?
नहीं पूछा था मैम,
क्यों
उसका
नहीं
हस्बैंड
पूछा?
शॉपकीपर है और
हम्म।
ये कन्वेंस नहीं है कोई भी, और अब
हम्म।
वो जो आई हुई थी तो उसके पीछे सास थी घर में उस टाइम ना,
हम्म।
तो उसकी मदर उसके पास थी हॉस्पिटल में और कभी आ जाती थी कभी चली जाती थी और उसकी सास मतलब उधर घर में थी. ये
तो
मैंने
पेशेंट
डिस्चार्ज
से
वाली
पूछा था कि
पूछनी
अभी आप
चाहिए थी.
हमारे पास 5 हफ्ते, 5 हफ्ते का मतलब है 1.25 महीना दाखिल रह
हाँ
सकते
जी.
हैं? Why you have not assessed your patient?
ये मैम मुझे पूछना चाहिए था उससे, मतलब इस पॉइंट ऑफ व्यू से, डिस्चार्ज वाले पॉइंट ऑफ व्यू से, ये नहीं मैंने पूछा उससे. के अकॉर्डिंग
एक
फिर प्लान करना
ट्रांसफ्यूजन
था.
के बाद कितनी एचबी उसकी बढ़ जाएगी?
मैम एटलीस्ट 9 तो होगी, बाकी तो उसकी
Will you
हेमेटोक्रिट पे फिर
discharge
डिपेंड
her
करेगी.
at hemoglobin of 9 gram per
नो
deciliter?
मैम, आई विल डिस्चार्ज हर ऑन हीमोग्लोबिन ऑफ 10 grams per deciliter. I
Then
will
manage her
transfuse.
properly.
Okay. Ma'am, she is at 32 plus 5 weeks. I will continue with expectant management, keep her admitted. In meanwhile, I will transfuse her blood to make her HB at least 10 grams per deciliter. And I will give,
Why 10
I
gram
will
per
give,
deciliter?
ma'am, because it is ideal HB in third trimester, and she is at the risk of emergency delivery any time in her pregnancy.
तो
So
फिर
at least her
10,
HB should be.
तो 10 रखेंगे. What is recommended hemoglobin of placenta previa in second trimester and
Ma'am,
in third trimester?
10.5 to term
प्रीविया की
10.5 to 11.
प्रीविया की 10.5 or 11.
11.
Then why you are discharging her at hemoglobin 10? ये तुम पूरी कोशिश कर रही हो वो बेचारी को मारने की.
मैम हमारे तो नहीं, हम तो डिस्चार्ज ही नहीं करते मेजर डिग्री को, जिसका प्रीवियस कार हो, जो मेजर डिग्री प्रीविया हो ना, और थर्ड ट्राइमेस्टर में हम तो नहीं करते, चाहे उसका
जब
घर
भी
भी
आगे.
करीब हो. हम नहीं करते उसको
What are
डिस्चार्ज.
recommendations and what are
नहीं,
indications
थर्ड
for HB?
ट्राइमेस्टर में नियर टू डिलीवरी.
तो उसे HB भी 10 पे ही बिठा के बैठे
तो
रखते हो,
मतलब
HB 11 करते हो या नहीं?
मैम HP करते
फिर
हैं
अगर
11.
पेशेंट घर जाना चाहती है और एक एपिसोड के बाद वो एसिम्टोमेटिक है, व्हाट इज फन
एचपी
ऑफ
11
कीपिंग हर
कहते हैं, फोर
एडमिटेड फॉर
पिंट्स ऑफ
5 वीक्स?
ब्लड ईच एंड एवरी, मतलब उसका रेंज रखते हैं. Charge after building her HP to 11 grams per deciliter. After this, I will and I will also counsel her to avoid coitus. On her every visit in the OPD, I will ask her about any, if she has any kind of pain or bleeding, develop any kind of or bleeding episode. I will check her blood pressure, and I will check her
2
protein
weeks she
urea. I
presented on
will
follow-up with hemoglobin 9 gram again.
मैं उसको हिमैटेनिक्स भी दूंगी ना,
वो तो दिए नहीं है, वो
ओपीडी के
चले गए
फॉलो
घर.
डिस्चार्ज में. मैम डिस्चार्ज में उसको हिमैटेनिक्स भी दूंगी, काउंसिल करूंगी कि वो डाइटरी एडवाइस टू इंक्रीज green leafy vegetables and meat in her diet.
Okay, what is cause of hyperproteinuria?
Ma'am, 24-hour urine protein to quantify, and then I will
Why
involve,
24
and
hour
she
urine
is
protein?
having gift. Ma'am, she did to quantify the protein urea, and also her BP, blood pressure is normal. She didn't give me any history of increased BP in pregnancy. Also, she didn't give me any symptoms of
Then what is cause of
urinary tract infection.
hyperproteinuria?
Ma'am, for that, I will involve nephrologist in my management
You have not
after
get her
quantifying
evaluated
protein
for her
urea.
proteinuria.
Hmm. मिस हो गया मैम मैनेजमेंट में
देखो
इसको.
क्या सारी मैनेजमेंट गलत की है. आपको हिस्ट्री एग्जामिनेशन इन्वेस्टिगेशन के बाद ये नहीं पता आपने पेशेंट को एडमिटेड रखना है, आपने डिस्चार्ज करना है. आपने उसका टाइम ऑफ डिलीवरी गलत
हम्म
डिस्चार्ज किया है, फिर आपने उसे घर भी भेजा है, तो एनीमिया की मैनेजमेंट गलत की है. उसे एक ही प्रिकॉशन बतानी थी टू अवॉइड क्वाइटस, वो उसे बता के नहीं
हम्म
भेजा.
हम्म हम्म हम्म. मैम इसकी इवैल्यूएशन करवानी थी स्टार्ट में, जब ये एडमिट थी, जब इसको ब्लड ट्रांसफ्यूजन हो रहे थे, तो इसकी क्वांटिफिकेशन के बाद इसकी नेफ्रोलॉजिस्ट से इवैल्यूएशन करवानी थी. और फिर उसके बाद सब ठीक रहता तो फिर इसको आफ्टर डिस्कशन विद द पेशेंट एंड अटेंडेंट इसको फिर डिस्चार्ज करना था, और उसमें वो सारी एडवाइस करनी थी.